Hello, I'm Dr. Renee Woods Harrison. I practice in Central Washington State, and my practice is called Central Washington Women's Health, where we practice the full spectrum of women's gynecology along with anti-aging and restorative medicine. I went to Southwestern Medical School in Dallas, which is part of the University of Texas medical system. Always one of the top 10 medical schools in the United States, has been for decades. And then following that in internship and residency, I went to Baylor University Medical Center in Dallas in the discipline of obstetrics and gynecology and became board certified with that training. And again, that was a very valuable training. Laparoscopic surgery was new at the time, and we were privileged to be able to do those surgeries as trainees when experienced physicians around the country were not yet able to have access to that. And again, trained by some of the best physicians and academicians in the United States in a hospital where they did more surgeries than any other facility in the U.S. So with that background of a high degree of high quality surgical training, I have continued over the years to develop my surgical skills so that we went from simple gynecology laparoscopies that simply looked for diagnostic purposes or did small things like the occlusion of fallopian tubes for the fertility concerns, but those developed ultimately to the ability to do laparoscopic hysterectomies, and now to the cutting edge technology of being able to do robotic gynecologic surgeries so that we are able to offer patients the safest surgeries, the least complications, the least time in the hospital, and the quickest return to normal activity when those procedures are needed. The anti-aging approach is to anticipate what could go wrong by knowing the patient's lifestyle, by doing testing to screen for problems in their earliest stages and get the patient turned around before health is lost, as opposed to waiting until they cross a threshold which is defined as disease and then say, okay, now we have a problem we can work with. Hormones form a symphony. There are hormones that come from different regions of the brain that signal the other hormone systems. There are the hormones related to thyroid, hormones related to digestion and how metabolism is conducted, such as insulin, glucagon, the hormones that come from the pancreas. There are hormones that come from the adrenal glands, which support and are integrally involved in all body systems, but are more or less in a supervisory position over the hormones of reproduction, so that if you have a problem in any of those areas of the higher hormone systems and you're trying to fix the resultant problems in the lower hormone systems, you can't get there because you have to get the whole symphony in harmony before you can get the music to be right. When we're treating hormone issues, we do practice with bioidentical hormones. And that term simply means hormones identical to what the body has been producing throughout life. And because the body has been producing it and they are identical, you can imagine that there would be little to no problem in the body to taking those because the body has always had those. It's the decline in that has led to the problem. I find that women in particular tend to be very courageous and self-sacrificing, and often they won't come in because they have tried to soldier through it on their own. They won't come in until their symptoms are unbearable. Those symptoms are cues, and that while the specific symptom may be the thing that she's looking to make better, those are windows into other systems that are also having problems that she may not be aware of but are critical to her ongoing life, longevity, and the quality of life that she's going to experience. So for example, hot flashes are very uncomfortable socially in terms of breaking into sweats, cosmetically breaking into sweats, flushing, but they are also an indicator that the woman's vascular system, or even a man, his vascular system isn't responding well to the hormone changes that are occurring, and those responses may be indicators of cardiovascular problems that need to be looked into. So by balancing hormones, the overall health and longevity of a patient can be improved and extended. Obesity has become an epidemic in our country, and that is not an exaggeration. And I happen to live in the county that I believe is second or third in the United States for obesity. It's clear to any patient who's tried to lose weight that it's not a simple matter of calories in, calories out. If they don't understand what are the mechanisms that cause that weight to be laid down and what caused that weight to be distributed where it is, and why might that weight be so tenacious in holding on and staying where it is, then they will be on that roller coaster of weight up, weight down, and the emotions that follow that. We can offer patients better strategies, both on how to lose weight and then how to live from now on to avoid that problem recurring. And for those areas where the fat may be laid down and still just doesn't come off, we can give them direction as to what they might do about that as well. If you would like more information about my practice or would like to be seen as a patient, you may go to our website and you will find all the contact information there.